Okay, hello everyone, bonjour. Je tiens tout d'abord à souligner que nous sommes réunis sur les territoires traditionnels de nombreuses nations, notamment les Mississauga du Credit, les Anishinabeg, les Chippewa, les Haudenosaunee et les Wendat. I am so glad to be in my own riding of University Rosedale today with the amazing team at the University of Toronto's Children's Dentistry Clinic. And I really just want to start by taking a moment to thank every single person who works here, whether it is the professors or the people who work at the dispensary or the people who do all the jobs that it takes to keep this school going. And also to really thank and recognize the remarkable students who are here studying so hard to take care of all of us. I met some students who were in their 10th year of studying since they graduated from high school. That's a long time to be working and learning. And I really want to say to the students, I appreciate so much your dedication. And I also want to say, I was really moved by my conversations with the students. And what I found especially touching is how dedicated they are to making a difference in people's lives. I learned that starting in the third year, they start having their own patients who they follow up with. And they told me how they really cherish developing that connection with the patients. I talked to a young woman, I'm not sure if I can call them dentists yet, but soon to be dentist, called Teresa, who is learning to be a pediatric dentist. And she made a point of saying to me that the reason she's chosen that specialty is she knows there are a lot of kids in Canada who don't have a dentist and whose teeth rot and who get sick because they don't have a dentist to take care of them. And she said she's studying to be a dentist specializing in pediatric dentistry because she wants to take care of those kids. Dr. Tam told me that they sometimes see kids here who need to go under general anesthetic. Really, really young kids, toddlers, who have to go under a general anesthetic because they have so many cavities. These are kids who live in Canada today who are not getting the dental care they need. I am so grateful to Dr. Tam, to everyone who works here, who is learning how to provide that care. And I am really glad that we are acting now to make that care available to some of the most vulnerable, underserved people in our country. Thank you guys for doing it. I do want to start by sharing some good news about Canada's economy. Just over a week ago, Statistics Canada reported that the Canadian economy grew by 0.3% in April. That shows that the Canadian economy remains resilient. The StatsCan flash estimate is that the Canadian economy grew at an annualized rate of 1.9% in the second quarter of this year. The Canadian economy grew at an annualized rate of 1.7% in the first quarter of this year. That is stronger than the rate of growth in the United States, and it's the second strongest growth in the G7. De façon générale, l'OCDE prévoit que l'économie canadienne connaîtra le deuxième taux de croissance le plus rapide du G7 cette année et le plus fort taux de croissance de 2025, à égalité seulement avec les États-Unis. Il s'agit d'éléments de preuve convaincants sur le plan économique. Il montre que l'économie canadienne est forte et résiliente et que notre plan économique est financièrement responsable. C'est vraiment important parce que cela signifie que nous pouvons nous permettre de faire les investissements dont la population canadienne a besoin, y compris dans le cadre du régime canadien de soins dentaires. C'est ce dont nous parlons aujourd'hui. Our government is committed to delivering fairness for every generation of Canadians. That's why last year we launched the new Canadian Dental Care Plan. Because up until very recently, in Canada, you've been able to tell how much money someone makes or how much money their parents make by their smile. That's not right. It's not fair. Our government is changing that now. Our government is changing that now. Already, more than 2.1 million Canadians have been approved under the Canadian Dental Care Plan, and around 250,000 Canadians have received care under the plan. Dental care is now available to eligible seniors, and as of June 27th, to adults with a valid disability tax credit certificate, and to Canadians under 18, the kids who are being taken care of here. That means parents or legal guardians can now apply online for the Canadian Dental Care Plan on behalf of their children, so that those kids can get the care they need at great places like the U of T Children's Dentistry Clinic. Tous les Canadiennes et Canadiens admissibles âgés de 18 à 64 ans pourront souscrire en ligne au régime de soins dentaires canadien en 2025. Au total, ça veut dire que l'année prochaine, jusqu'à 9 millions de Canadiennes et Canadiens non assurés bénéficieront d'une couverture dentaire. Jusque-là, ces personnes paient elles-mêmes pour prendre soin de leurs dents. Our Canadian Dental Care Plan is already making a real concrete difference in the lives of millions of Canadians. Thanks also to the really loving, thoughtful care that dentists like the ones who are here with us today are providing. And we want to make it even easier for Canadians to get the dental care they need, and for providers like the clinic we're at today to deliver that care. That's why, as of yesterday, dental care providers have the option of providing their services on a claim-by-claim basis without having to formally sign up to the Canadian Dental Care Plan. This means that people who are covered under the Canadian Dental Care Plan can see a provider of their choice, as long as that provider agrees to bill Sun Life, the insurance company who manages the Canadian Dental Care Plan on behalf of the federal government, directly. This new simplified process means that all dental care providers across the country can now provide care under the Canadian Dental Care Plan. By making it easier for providers to participate in the Canadian Dental Care Plan, more Canadians will be able to receive the affordable dental care they need, from seniors to people with disabilities to kids, including the really young kids who get treated here. Un plus grand nombre de Canadiennes et Canadiens n'auront plus à choisir entre prendre soin de leurs dents et payer leurs factures. Voilà, c'est que l'équité. Our government is acting now and acting with purpose, because we know that Canadians are counting on us. Thank you very much for being here. Thanks again to everyone who works here, and a special thanks to the really dedicated, really inspiring young students who are working here today. It's now my pleasure to pass it over to the person who makes it all happen, Dr. Laura Tam, the Dean of the Faculty of Dentistry at the University of Toronto. Dr. Tam, over to you.
Thank you, Deputy Prime Minister. Good morning, good afternoon, everyone. It is a sincere pleasure to stand before you today and share with you what today's announcement will mean for the Faculty of Dentistry. Each year, we treat more than 15,000 patients at our 14 clinics, with nearly 2,000 of them children in our pediatric clinic. The Faculty of Dentistry serves patients experiencing barriers to accessing dental care by providing costs that are dramatically lower than that of private practice. However, for many patients, that cost is still unaffordable. The Canadian Dental Care Plan aligns with our mission to provide dental care to those in need. We have accepted many patients through the CDCP since we enrolled several months ago, and we are happy to say that we and patients have had a positive experience. Now we look forward to providing the same wide-ranging scope of treatment to our youngest patients. We know how essential oral health care is to overall health. Our graduate specialty program in dental public health studies the inequities in our healthcare system due to lack of access to care. Programs like the CDCP will help to address these disparities. At our faculty, we are looking ahead to celebrate 150 years of dental education in Ontario in 2025. We are constantly making updates to our facilities to help us maintain our excellence in research and patient care while providing the best training for our students who become our future dentists. As we look to next year's milestone, we are grateful to mark the CDCP as an important step in oral health care in Canada. On behalf of the Faculty of Dentistry, I want to thank the Government of Canada for helping to improve access to oral health care across the country. Thank you.
Yeah, and thank you for your work, Dr. Tam.
We'll now take questions from media. It will be one question and one follow-up. Please state your name and media outlet before asking your question using the microphone behind the cameras. C'est une question et un suivi. Veuillez indiquer votre nom et votre média avant de poser votre question dans le microphone. Maintenant, la première question.
Hello, Deputy Prime Minister. My name is Ali Alwal. I'm with CBC News. The Privy Council said it made a mistake vetting the appointment of Canada's new human rights chief. Key information was not vetted nor sent to the RCMP or CSIS. What do you make of this, especially after the Prime Minister said in 2021 he was looking to improve the vetting process for high-level appointments after what happened at Rideau Hall? Did anything change?
As the Minister of Justice has said, that's unacceptable, and we need to do better, and Privy Council needs to do better.
Okay. And then I have a question from our team in covering NATO. In light of the letter from U.S. lawmakers and warnings from the Business Council of Canada, was it felt that these meetings the Prime Minister is having today and yesterday in D.C. necessary to reassure our Americans?
Thanks for the question. The Prime Minister is in Washington right now, working very hard. I think it's important for Canadians to recognize that Canada is the 7th biggest defense spender in the entire NATO alliance of 32 countries. We are a major contributor to our defense and to defense of our allies. NATO currently has 4 enhanced forward presence battalions on the Eastern Front, where the pressure is the greatest. One of those 4 in Latvia is led by Canada and has been led by Canada at the outset. I think we all recognize that the greatest threat posed today to global security, to NATO, to democracy, is the illegal Russian invasion of Ukraine. And Canada has been one of the leaders in the world in supporting Ukraine. We have provided significant financial assistance, significant military assistance, and Canada has been there with Operation Unifier since right after the first illegal Russian invasion of Ukraine. So I really want to be clear about all of that, because Canadians rightly see the importance of Canada's contribution to global security and to our security, and Canadians should be proud of the role Canada is playing. It's also the case that under Stephen Harper's Conservatives, Canada's defense spending fell to less than 1%, to 0.9% of GDP. Our government has been steadily increasing our investments in defense because we recognize the threats in the world. And in the budget that I tabled in April, we put forward a fully costed plan to get our defense spending up to nearly 1.8% in 2029.
And finally, will you be cheering our boys on tonight at COPA?
Yes, 100%. 100%. And also, by the way, Alfonso Davies, he's from Edmonton. I am too. So extra cheer for him. But yeah, Canada's performance has been outstanding. It's been a great sports year for Canada. And since you asked, I do want to give Edmonton a little further shout out and say, while the whole country was heartbroken that the Oilers didn't quite make it to the Stanley Cup, they worked so hard, they played so hard, they came really, really close. I think we're all proud of them.
Next question. Okay, ceci conclut la conférence de presse. Merci tout le monde.
Okay, and I want to just say one last thing, because I said this to the amazing dentistry students. In addition to thanking and congratulating them, I asked them to say to their parents that I congratulate their parents also, and I'm glad to say that publicly. It's a really big deal to have a kid who is doing this, and as a mother myself, I just want to say to those parents, you've done a great job. I'm sure you're so proud of your kids, and Canada's grateful to you. Thanks a lot.